India's digital health scene is absolutely exploding with new ideas and technologies. But here's the thing. With all that innovation comes a massive risk. So today, we're going to get into how companies can navigate this super complex world of data privacy and, actually build a future for healthcare that people can trust. First up, let's just get a sense of the stakes here. $10 billion. And no, that's not some tech company's valuation. That's the estimated cost of healthcare data breaches every single year globally. This isn't just about the money, though. It's about something way more valuable, the trust the patients have in the system. And that really brings us to the central question, doesn't it? As India dives headfirst into digitizing its healthcare, how can all these amazing organizations use the power of data without, completely shattering that patient trust? It's a really delicate balancing act. To even begin to understand how to walk that tightrope, we first have to appreciate just how huge the opportunity is that's driving all of this change. So, India's National Digital Health Mission, or NDHM, it's a total moonshot project. The goal is to create this one unified digital healthcare ecosystem. Just try to imagine a future where every single citizen's health records are digital, where getting care is seamless, and healthcare becomes accessible to over 1.4 billion people. The potential here is just staggering, but man, so is the responsibility. For any company working in this space, especially if you've got your eyes on the global stage, it's kind of like having to become fluent in two totally different languages of data privacy. So let's break them down. Okay, so on one side, you've got HIPAA. This is the big one from the US. It's a federal law that has pretty much become the global gold standard for protecting health data. It's been around since 1996, so it's well established, it's legally binding, and trust me, it comes with some serious teeth if you don't comply. What makes HIPAA so powerful is that it's so thorough. You've got the privacy rule, which is all about who gets to see your data, and then you have the security rule, which dictates how that data has to be locked down. And the penalties, they are severe. But the real genius, I think, is this idea of minimum necessary. It basically means if a doctor only needs your blood type, they shouldn't be able to see your entire life's medical history. Simple, but so important. Now, on the other side, you have India's NDHM. It's a much newer framework, and it was really designed from the ground up for a digital-first world. Where HIPAA is all about setting these really strict rules, the entire philosophy of NDHM is built on one simple but incredibly powerful idea. The patient's consent is everything. You can see right away, this is a fundamentally different way of thinking. Every citizen gets a unique health ID, but, and this is key, their data doesn't all get dumped into some giant government database. Nope. It's federated, which is a fancy way of saying it stays with your individual doctors and hospitals. Think of it like a decentralized network. This massively reduces the risk of one single catastrophic data breach. And at the very heart of it all, the patient. Nothing gets shared without their explicit, specific, and easily revoked permission. All right, so we have these two different philosophies, right? One is driven by the force of law, and the other is driven by patient consent. So let's put them side by side and really see where the rubber meets the road. This table really spells it out. Look under legal basis. HIPAA is a federal law with real criminal penalties. NDHM is policy-based, although it's now getting some backup from India's new Digital Personal Data Protection Act. But the biggest difference, for my money, is under consent. HIPAA has some exceptions, but with NDHM, the patient's explicit consent is needed for everything. And that difference leads right into enforcement. HIPAA has a big government agency that can hand out huge fines, while NDHM's enforcement structure is still kind of taking shape. And that right there, that's the crucial gap. If you're an Indian health tech company and you want to play on the world stage, just following a policy-driven framework, even with the new DPDP Act, might not be enough to build that international trust. To really compete, you need to embrace the kind of rigor that comes from a system with real, serious legal consequences. So what do? How do you bridge that gap? Well, the answer isn't to pick one or the other. It's about creating a hybrid model that really takes the best of both worlds. And here's a practical playbook for exactly how to do that. This 5-step plan shows you how to build that hybrid system. So first, you start with NDHM's amazing consent-first architecture.
That's your foundation. Then you start layering on top of it HIPAA's heavy-duty technical safeguards. We're talking serious encryption and strict access controls. You also have to build strong internal governance, like having a dedicated data protection officer. For research, you use HIPAA's tough de-identification standards to keep patient privacy safe. And finally, you have to commit to continuous auditing to make sure your systems are always secure.
And the payoff for doing all this work? It's real and it's tangible. This approach opens the door to partnerships with global organizations, it builds rock-solid trust with your patients, and it drastically cuts your risk of a devastating data breach. Basically, it turns compliance from a chore into a massive competitive advantage. So let's just zoom out for a second. Why does all of this really matter? Because getting data trust right isn't just about dodging fines. It's about unlocking the entire future of digital health. Look, there are definitely challenges. Regulatory gaps, the complexity of managing consent, finding the right tech. But the opportunities are just immense. A strong hybrid governance system doesn't just protect you, it makes you a leader. It builds the kind of trust you absolutely need for game-changing innovation in AI and telemedicine, and it gives you a voice in shaping the future of healthcare policy for all of India. So, we'll end with a question for every single person in this field. Every leader, every developer, every doctor. The future of digital health in India is being written as we speak. The question isn't if you're going to comply anymore, it's whether you're going to lead. So, are you ready to build a future where innovation rests on a foundation of unbreakable trust?